Right, part two, light's bad. You know, it's that time of year, it's January, and I thought I had enough time to make this outside before I ran out of light, but so be it. So, my wife and I, we got a big family. Uh, and it's actually kind of amazing when I think about it. I got 6 sons, I have six boys, and I've not had to take them to emergency rooms very often. Now, we don't go running to emergency rooms for nothing either. Although I suppose in the past we did more of that than I would like to admit. But we've certainly learned not to do that, and to be patient and kind of wait and see with certain things. I mean, obviously, somebody's missing a finger, you're going to go to the hospital. We haven't had to deal with that. But we're not running to the doctor for every little cough, and thank goodness not a lot of that most of the time. We haven't had any major illnesses with anybody for the most part. We had an event with our daughter that I've certainly documented here on YouTube, where she spent some days in the hospital, and we had a little boy who was born with a heart condition, and we've documented that here, sharing her story. But for the most part, we stay out of the doctor's office. We stay out of the emergency room. But with that said, with all of those boys, I'm just saying that we have not had, and I mean my daughters too. They're very active. Everybody climbs a tree, jumps on a trampoline, runs and bikes and plays. Nobody's sitting with their face in front of a television screen or a tablet or a phone all day playing games. They read. My kids will put books in a backpack and climb to the highest, one of their favorite parts in a tree where they're comfortable. Got a big old oak tree, and sit up there and read for an hour. That's what they like to do. So they're combining this kind of exercising of the mind with exercising of their body out of doors. It's a beautiful thing. But we haven't had a lot of major injuries. Well, really no major injuries, but not too much that we haven't been able to deal with on our own. Well, my second son, Benjamin, he'll be 12 soon. He was running through the backyard. He's a little, what would I say about Benjamin? He's a little clumsy, but not so much with his own self. Like he's got a good spatial awareness. He's got good balance. He'll drop things. Like we joke with him, not picking on him, but joke with him, and we're telling the truth. He's probably broken more dishes in the family than everybody else combined. I mean, I don't know what he's doing. He's a smart kid, and so he's always kind of like a little bit distracted. Not always, but he's thinking all the time. He's always thinking. And so I think sometimes his focus is not quite enough on his task to be as careful as he needs to be at times. But he one time smacked his head on a coffee table, which we don't have anymore. Had a point on it and hit his forehead on it and had to get some stitches in there. And that was one of those deals where if it had been me, I wouldn't have got it sutured up. If I wasn't concerned, and I'm not going to say worried, but concerned that somebody might wonder why I didn't take my kid to the hospital, because those are the days we live in where you don't have the rights as a parent you think you have. You better do what's expected of you, because if not, you got problems. So that's kind of one of the things we're always weighing out when we're considering whether or not somebody needs to go to the hospital. He got maybe four sutures. It wasn't super deep. I mean, it was deep enough that something needed to happen to close it up. I probably could have closed it up with skin glue. That's a chemical I probably wouldn't. I think what I would have done was probably just kind of trim the hair back a little bit and done some butterfly suturing up there. And we know how to treat a wound to make sure it's not getting infected and keep an eye on it. I mean, we're very good at that. I've had no issues there. I've had surgeries. I've taken care of myself, and I've had things that most people would go and get sutured up, and taken care of the wounds and never had a problem. But, being that the things are the way they are, we went ahead and took them. Now, at that time, we had had less experiences that were really, to say they're negative is an understatement. Some really seriously eye-openingly negative situations that we've had to deal with going to hospitals or whatever. You're signing away your rights. When you're signing something on the VeriSign there, it's not even signing a piece of paper anymore. And you're putting your signs and symbols on that you're going to let these people treat your kids. I mean, you've just signed away your rights as a parent to make decisions for them. And, they really do put on airs that you've got these rights, but you don't. So that's just, you got to look into that on your own. You don't have the rights you think you do. If you believe that you can go in there and dictate to those people, you're very much mistaken. So anyway, that's one I probably wouldn't have taken him for. But this day, a couple days ago, he was running. We've got a door that comes out the side of the garage, and it's kind of like this little side yard, and then it opens up into the backyard. Well, right on that corner, we've got a patio that's got a little brick wall about 2 feet high that surrounds the patio. And I don't know how he did it. He says he didn't slip or trip on the way. He just kind of took the turn, running to his right too fast and too sharp. And he was bringing his right leg forward with his knee as he was coming around that corner, and he just slammed his knee into the brick wall, right into the corner of the brick wall. And he actually, it's kind of amazing when you think about it. I mean, we don't feel like, we know our flesh is soft, but man, he put a big hole in there. Now, he's very fortunate, and we thank the Father so much that he didn't hit his kneecap, because he could have literally, with the amount of force that he hit that wall with, he could have hit his kneecap. He could have shattered his kneecap. But he hit in the meat just above the knee. And he made a hole about as deep in that meat as he can. I'm not trying to be gross or anything, but he got down. He didn't get into his patellar tendon or anything like that, but he got deep in all the way through the epidermis and through the dermis, and we saw fat. I've had wounds like that. I know that don't freak me out, but I know it was deep. He was wearing his jeans, so the real positive thing, and I recognized this right away, was that the skin was all still there. It kind of all bunched up at the bottom of the wound as he hit this corner of the brick, and it kind of squished all that down there. I'm not trying to be nasty, but when I first looked at it, I know enough to realize that if this was a hole, like a puncture wound or something that's real deep, that's got to be packed, and there's more cause for concern for an infection, and the dressings need to be really taken care of the right way, and the healing takes longer because your body's got to granulate all the skin back into this hole. If you got a flap of skin you can pull back over it like a big old, your own skin bandage, that healing goes a lot smoother. And so when I looked at it initially, I didn't see that, and then I took a closer look at it and I realized that skin was still there. Now look, if we were in a vacuum, if we were in the wilderness, I mean, outside of the concerns that we have, I feel confident that I could have dealt with that wound. But this was a no-brainer. It was deep enough, not like his forehead cut, where I thought, I really don't need to risk this, because if I were to take him to the doctor because he did develop an infection, which again I was confident he wouldn't, I really am. I mean, I don't know what else to say. Like, this was no major injury. It was a flesh wound, and it was a deep one, but it was certainly something that we're perfectly capable of dealing with. But if for some reason there was a complication and I had to take him for some medical care later, the questions are going to be asked why he didn't come sooner, and it's one of those risks we're not willing to take. But at the same time, I understand that going to the hospital is a risk. I'm going to have to go there. I'm going to have to sign my rights away, giving these people permission to treat him. And if they say he needs it and I say no, and they want to stand their ground, their right supersedes my right in that situation. Again, you think that's not true, you're being a fool. It's just a fact. And so you got to know how to operate within that. First of all, we're prayerful about it. I'm not going in there afraid. I'm going in there to understand that I've got rights given to me by my Father as the temporary earthly father of my son. And I'm not going to be pushed around, but I'm also not going to go in there acting like I got rights that I know I don't have. And that these people don't always want to go pushing you to the point where they're telling you that you don't get to decide, you don't get to pick. They don't want to do that. They want to keep their front. They want to keep their airs. They want to have this facade out there that you're in control as a patient, and you're in control as a parent, and you've got a minor child in there who's a patient. And so, you got to know how to walk that fine line. You know how to, you got to stand for the rights that your Father, your Creator, has given you, but you got to tread that line carefully. So I understand that there's risk going in a hospital like that. And nobody really thinks about it. But okay, we see 4 different nurses. I see 3 different doctors. And of course, everybody asks, how did this happen? 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 Ad nauseum, over and over and over again, how did this happen? You know how it happened. There's a shift change. The ER doc who was there when we got there, she's leaving, and the next one's coming. This next ER doctor knows what happened. She knows that the boy was tearing around the corner and slammed his knee into a brick wall. How did this happen? You lost a fight with a desk? Come on. You don't ask that question unless you're trying to find a crack in the story. Over and over and over again asking that question. And I've never had an experience where I've had to take somebody to the emergency room. I'm talking about one of my kids, where we're not treated that way. And it's asking it. You're going to look for a lie. Ask, again and again and again and again. What is it? All these questions. So that's one thing that I got a problem with. And they can make you feel nervous. I'm not nervous sitting there. I don't bother me at all. But that's come with some time and some prayer and some understanding that I can go into a situation like that and not be afraid of it and not be concerned about it. But you're always on the edge of somebody having some question about you. And look, I've said it before. Like I said, put way too much information out there, probably way too long of videos. Most people don't care to watch all that stuff. But about our daughter's experience when she had to be hospitalized for a short while. We were judged because of the way we raise our family. We were judged because our family's big. I was judged because I got a big beard. We were judged because my wife showed up to the hospital to visit her for about 20, 30 minutes and went back home. She got a whole house full of kids to take care of, and not leaving somebody else watching that many kids for a while, because not many people are equipped for that. That's a big deal for somebody. And so all kind of judgment that we could get into a little bit more about that. Maybe I will as I get into this about what some of that judgment was. But I almost didn't make it out of the hospital with my daughter because of the way that people judged me. 100% false. No good reason to really have felt that way. And with an enormous amount of evidence that they were witnessing day to day while we were in the hospital right in front of them, that I couldn't possibly be the sort of person that they were thinking I was. So, whatever to that. And, thank the Father that he helped us get out of there without question. And that's a good story. There's a series, First Do No Harm. You can go back on the channel, and it'll take you a while to get through them, but, maybe watching at least part of that's probably pretty useful. But anyway, when we got in there, the first thing they want to do is give him pain drugs. They want to give him acetaminophen, ibuprofen. They talk about it like it's just, eating an apple. Like there's no problem with it. Ibuprofen builds up in your system. Ibuprofen does not fully get out of your system, and if you keep taking it, yeah, okay, you're taking a recommended dosage that's not too bad, but got a phone call to decline there. But it's not always getting out of your system. It's building up in there. There's a toxicity to it. There are side effects to it. And, I understand. I'm talking to my 11-year-old, almost 12-year-old. I have conversations with this young man that, I have a relationship with them that's different than most parents' relationships as far as I'm concerned in terms of the way that we communicate with each other. And I can ask him, and he'd tell me. He's not afraid. He's calm in there. Dad's calm. He's feeding off of me. How you feeling? How's the pain? Can you bear it? And we teach them. We don't teach them that every time something's wrong in life, you can't sleep, take a sleeping medicine. You're depressed, get some happy pills. Or you have pain, we'll give you pills to take your pain away. Because the pills don't take your pain away, at least not for long. The happy pills don't work forever. They mess you up in all sorts of other ways. The sleeping pills, that's not your problem. You got other problems you got to deal with, both physiologically and spiritually. And, you can get beyond those problems. So, I have an understanding that, the boy's going to be able to handle this pain. He's not crying. He's not freaking out. He's totally calm. They're messing around with it. He winces a little bit. He's got a hole in his knee, and they're poking around. They're not really even very gentle about it, when possibly sometimes they can be. Now, I get they can't, but all the time. But the point is, they're being kind of rough down there, and he's handling it without any problem. Well, why are you pressing me? I got to say, and I got to lie a little bit. Frankly, I got to say, look, he's got a sensitivity in his stomach. He hasn't eaten in a while. You're telling me he can't eat or drink right now, but you want to give him his ibuprofen. And I'm saying, hey, ibuprofen, they say Motrin. I say, he's sensitive to that. She said, oh, well, I guess it's not really. She wants to go into this. She spent a solid 3 or 4 minutes telling me how, well, it is possible. There are some people, rarely, who have some kind of sensitivity to ibuprofen, but for the most part, that's not the case. But there is acetaminophen, and pretty much nobody has a problem with that. And I'm like, he's fine right now. What are you going to do? Are you going to clean it out first? Or are you going to put some sort of a numbing agent, a gel on it or something before you start really working on it, including the cleaning? What's going to happen? Well, the answer then is they've got a numbing gel. They're going to fill the hole with numbing gel and kind of cover that whole area with some numbing gel before they even irrigate it or wash it out. And that normally it's really effective. Sometimes on the extremities people feel a little bit and they might have to give them the xylocaine with the needle. But a lot of times people can have a cut, even a deep one on their face or something, where they can just use this gel, and that's enough to stitch them up. So why are you trying to push me to give my son this oral pain drug? I mean, are you paying attention? These people don't even trust their eyes. They're just give them drugs, give them drugs, give them drugs, give them drugs. And again, there's different reasons for that. Billing for it, whatever. The more they can do, the more they can charge for, the better for them. And I gotta say, look, I don't want him to get sick. I don't want him. He's sensitive to it. Let's see how he does. Look, you can see him. He's not in a lot of pain. Ben, you okay? You can handle it. He's fine. And then, of course, I got to walk this fine line because Ben, he can be loud and he can be funny and he can be even a bit obnoxious, but he can also be real quiet and shy when he's around people that he doesn't know. And when he's just such an intelligent person, like, and he hasn't learned that how he's got to operate in these systems. And when somebody wants to ask him a question 40 times, he's not interested in answering you anymore. When you've asked him where he is on the stupid pain scale with the crying faces and smiley faces, and he's already given you an answer a bunch of times, you come ask him again, he don't really want to answer you. He's kind of quiet. He just kind of looks at you. He's like, I'm okay. But he doesn't say much. He's quiet. Well, gosh, a quiet kid. Oh, maybe something bad's happening to him. I mean, it's just so... I'm cynical, but my cynicism is realism, So anyway, keep trying to press to get him this pain med. When if you just pay attention, you can tell the kid doesn't need it, and you're gonna numb up the surface anyway. You're gonna numb up the whole inside where this hole is with this gel before you even put a needle on him or try to wash it out. But I mean, it took me, I'd say 8 to 9, 10 minutes, maybe at least 8 or 9 minutes to convince this woman to leave me alone about giving him a drug. He doesn't need it. And she was very reluctant about that. And I mean, if I didn't handle that exactly the right way, she wouldn't have left me alone. But she did. Sometimes I think the beard helps people leave me alone. It helps them judge me too, but I think it helps them leave me alone from time to time. Anyway, the other thing was they put me in a room where it wasn't a room. So I'm sitting in there with my son, and it's just a curtain between me and this other room because they were real busy in there. And instead of making us wait out in the room, he's not dying. We could have just waited outside in the waiting room. They put me in here. And then shortly before, I don't know which, because I was focused on my own son, I realized that either somebody just came in or we were put in there with somebody who was sick, like really, really sick. There was a girl, teenage girl, by the sound of her voice and what I could kind of make out from what they were talking about. And relax, I'm not eavesdropping, it's a curtain, so I can hear what's going on over there. The girl's coughing, talking about how she's been thrown up since 4 o'clock in the morning, how many times she's thrown up, a dozen or more. She's got this horrible pain in her back, a horrible headache. They don't know what's going on with her at this point. They've got no idea, but she's just right there a curtain away from me and my kid, and she's sick. And who knows what kind of sick. And they're just leaving me in there. So I asked somebody, because I hadn't really heard much about what was going on with her, but I knew she wasn't feeling well. So I asked if I could get a mask for Benjamin. I said, can I please get a mask for him? So they gave me a mask. And I knew, because I had heard that they were busy, and we basically got into the last room that they had at that point. And then I did pay some attention to what was going on over there, and I listened to a little bit about how she was feeling. And I came out and I said, I would like you to move us. I don't want to sit in here with my son, because this girl, who's just a curtain between us and him, is clearly ill. She's very ill. And I'm not trying to eavesdrop, but I understand that you don't know what's going on with her. You don't know what her problem is. You don't know if she's contagious. I didn't come in here to get sick, and I didn't come in here to get my son sick. And I want to move. So the nurses, they understood that they shouldn't have left me there next to this person. The doctor, she didn't like this passive-aggressive argument she was having with them, letting them do it, but letting them know that she didn't think that we should have to move this guy and his son. So she's following them around. Oh, blah 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 this and blah 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 that, and we could just do this, and we could just, and it's we really could use this room for something else, the room that they were sending us to. So never should they have put us in there next to this person who is coughing and vomiting. I'm just in there to get him sutured up, I mean, there's no worse place. If you want to be healthy, there's no worse place to be than being in a hospital if you want to be healthy. That's a great place to get sick. That's just a fact. And anybody who says otherwise, you just don't know what you're talking about. So I had to, and I wasn't mean. I mean, I'm always trying to be very respectful and treating people with kindness, but at the same time, I'm being very firm. I'm saying, I don't want to be left in this room next to this girl who's clearly ill, and you all don't know what's going on with her. It's time for us to move, please. I understand that if you're busy and you don't have a room, we'll wait somewhere else until you get a room ready, but I don't want to sit here. I'm not sitting here with my son. I really need you to move, and I hope you understand. And so that happened, and they moved us. And, the thing I wanted to mention about the system is these two things. One has really not much to do with this medical professional system, but just this kind of beast system that we're living in and what it does to us. People have so little compassion, and everybody talks about it. It's kind of like a joke now. Oh, somebody's getting beat up and everybody's got their phone out to record and nobody helps. But I'm telling you, I could hear before they moved us, this girl's mother. She's sitting there. You could tell the girl where she was. Her bed obviously is right parallel to the bed that my son's sitting on. She's facing away from us. They were giving her fluids because she's been vomiting. They've given her pain drugs because she's in a bunch of pain. She's moaning a little bit. Her mom's sitting at the foot of the bed, and you can tell by the sound of her mom's voice, she's got her head down and she's looking at her phone. And the girl's got to say a couple times, "Mom, I'm so cold, I'm so cold." And then it's like waking somebody up. You can hear. If you've got ears to hear, you can picture it in your mind. And I could see that woman sitting there looking at her phone, not paying attention to her daughter that needs compassion and care. What? Oh, you're just cold because they're giving you fluids. And she was cold. This woman was cold. I'm not saying mean, like just kind of like everybody else out there, just so cold. I just watched a little rat run across the road over here. Oh, man. Anyway, then the girl was saying, "Miss Mom, my back hurts so bad, and my back, it hurts. It's not getting any better." And the mom, again, same thing. Little girl's got to say something a couple times before I'm like, "Well, it's got to take some time. They're just giving you a little bit they're just giving it to you. It's got to take a while." And at no time that we were there waiting to be moved, did you know that this woman had gotten off of her chair at the foot of the girl's bed and sat next to her and put her arm on her arm and pushed her hair away from her face and comforted her. And it's funny, I was talking to Teresa about it later on, and it's things like most people maybe don't notice and don't even think are a big deal. It's a big deal. This lack of compassion from this girl's mother, it's a big deal. It's no small thing. It's a scary thing to consider that this is the people around us and this is what they're like. To me, it is. It's eye-opening. It's, don't trust anybody out there to do anything to help you, because that's not the way people are being raised. They're being conditioned to be exactly the opposite of that, and that's a fact. It's the girl's own mother showing her an absolute lack of compassion. Sitting at the end of the bed, and Teresa brought up, she's probably posted it on Facebook or Twittering about it so that she can get some, "Oh, I'm at the hospital with my daughter," getting sympathy from people on social media instead of treating her daughter with empathy and compassion. The other thing I wanted to mention about it was when we got moved to the other room, two rooms away, and you could hear this poor little baby screaming. And I got to tell you, I've heard babies cry for all sorts of reasons: hungry, scared, got a bump, got a little hurt a little bit, and there's a different kind of crying. The cries, we got a lot of kids, Teresa and I, and we've heard a lot of babies crying for different reasons. And our son Rennie, when he was born, he was in the NICU, and they're sticking needles in him and all this stuff. Heard him crying for pain, heard him crying for different reasons, for being lonely, and you can tell that there's a difference in those cries. But I think, like, how many people even know the difference in these cries? And then there's, and it's because of the heart drugs. We've shared it. The powerful heart drugs that he was on, which he didn't need because the Father had healed him. But we just got to follow the system for a while and pray protection and work with our really awesome, cardiologist guy could lose his license if he doesn't practice a certain way working within the system that he had to work within to get him off of those drugs as fast as possible. But 4 months in, Rennie stopped growing. He started losing weight, and he was in a real dire situation. Didn't matter how much nourishment we were giving him. When we were just piling him up with foods to build up his system, to supplement the breast milk that he was getting, which, just by the way, most of our kids are way off the charts, and all they're doing is breastfeeding for the first year. So it had nothing to do with that. He was nursing fine. There was no issue there. It's that he just wasn't. It was all about this disruption of the electrical system in his heart and what was going on with that. But hearing him cry because he was hungry, because he just wasn't getting enough, that was a different cry. This little girl, and I assume it was a little girl, sounded like a little baby girl to me. I mean, a baby was screaming. I mean, such distress. I mean, this was just this terrified, deep, deep distress, this cry. And I would listen to her cry. And I got to tell you, I was tired from being in there for hours. I was in there for hours, and all they needed to do was check him out and suture him up. But we were in there for a long, long time, exposed to somebody sick, asked a bunch of questions we don't need to be asked over and over and over again to find out something that isn't there. Took forever to get us out of there, but man, that last probably 35, 40 minutes listening to that little baby crying. And she stopped just because she was hoarse and she couldn't cry anymore. And then she started again worse than she was to begin with. That sucked so much of the life out of me. And it's like, I don't know what's going on in there, but I've seen things like that. That baby needs somebody to pick her up. Damn it, that baby needs somebody to pick her up. She needs to feel somebody holding her. She needs to hear somebody breathing. She needs to hear a heartbeat. And she just needs to be loved. She needs somebody to show her compassion. And they just left her laying there screaming. But see, I understand too the people in those situations, as far as the people who work there. You work these long shifts. I know how people work, these nurses. I know that they wear these people out. And you give them way too much work to do. There's only so much people can do and still treat others like real men and women, real, boys and girls, treating them like humans, treating them like with real compassion and care. There's only so much of that you can handle before you just kind of shut down and you're kind of defending yourself. You're protecting yourself against the hurt and the pain around you. And people don't know how to deal with that right. If you're spending your whole day in a hospital on people who are hurt and crying and yelling and screaming, man, that does something to you. And you need to know how to deal with that properly. And who the heck does? But nobody showed this little girl compassion. I tell you, it was really almost all I could do to just not say, Benjamin, I'll be right back. You got your book to read, and just walk down there and hold this little girl. Last point I want to make, which doesn't have anything to do with the medical system and this lack of compassion that's just ingrained through the system into the people who work into it, taking good people and turning into, less than good people, a lot of them, frankly. And we've had some experiences with people we dealt with, you can't call them good people, was that when the doctor came in, this was the second ER doc, the one who's asking, even though it's already been asked over a dozen times, and it's known that he smacked his knee running on a brick wall in our yard, and what the brick wall looks like and where it is, and da-da-da-da-da. Oh, yeah, lost a fight with a desk? That woman, she asks him, oh, I see you're reading a book. That's old school. And the way she said it, because she's not even intelligent enough to use something better than old school. Quaint, maybe, would maybe be a more poignant thing to say. Oh, that's quaint. Oh, you're reading a book? Oh, that's nice. You sure you don't want to play a game? This woman took it as a personal insight because she asked several times, you sure you don't want me to play some tunes? At least my age, in her 40s. Oh, you don't want me to play? I could play some relaxing jams. You want me to play some jams? Just would not, and he's just looking at her like, no, I don't want the phone in my hand. I'm gonna watch you fix my knee. We've told her he's not squeamish. He's gonna watch what's going on. It doesn't bother him. And when he's waiting for people to come in, which we did a whole lot of waiting, he read his book. He finished that book, started reading another book. When he was reading his book, I read my book. I talked to him, kept it light, made some jokes, let him know what to expect, but we just sat in there and read patiently. But this woman could not stand it. She asked 6, 7, 8 times, you sure you don't want, you sure you don't want, I want to give you my phone. Are you sure you don't want it? She could not stand that the answer was no. I mean, it's so ridiculous. And it reminds me of one other thing that's unrelated to this experience. Teresa was waiting in line at a thrift store, when it's half off day. And the woman she's standing next to wanted so bad to shove her phone with games and videos on it in front of our youngest daughter's face because she was just a little bit fussy. And Teresa's like, yeah, no, that's fine. She's going to be fine. It's not good for the kids to have the screen time. And this woman was like, oh, yeah, you're right. And then went on to proceed to ask again, if you change your mind, you sure? I'll let her look at it, da-da-da-da-da. The boy is not in pain. He doesn't need pain meds. He's entertained enough by his book. I'm sitting in there chatting with him. I haven't left him other than to get up and use the toilet for a minute and ask to leave the room when we were in a room with somebody, super sick. And I got thoughts about why she was sick, but I'm not going to get into that in this video because I'm almost out of time. But you got to insist on putting a phone in front of his face. I mean, give me a break. This is one of the reasons, and I know things are changing, and part of us getting away from this system is we need to get outside of it as much as we can. I mean, that's just a fact. This is slavery, folks, and I'm going to make a video talking a little bit about that kind of briefly here in the near future. Maybe tonight, I don't know. Post that one too. But man, I hate going to the hospital. And I'm frankly just relieved when I get out of there. Just that they actually let me out. That they released my son to me. That's what it is. That release is they're releasing him to me. They're in control. They've decided that they're going to give him back to me to take care of him until they want to take him away, if they ever feel they have a reason for that. And, again, it's nonsense, and there's a lot more behind that. It's not innocent. It's not caring about kids. There are people within the system that have that feeling, who believe that's what it's about. But that's not what the system's about. And there's a lot of people within the system, top to bottom, that their goal is not to do what's right for kids and not to do what's right for families. So yeah, I was relieved that he was released to me. But he's fine. We're 2 days later. He's got no swelling. He's walking around. No inflammation whatsoever. He doesn't have an infection. He's feeling good. It's healing. And I will say this, Dr. Phone in your face, you were skilled at your suturing. And I had an injury a couple of years ago where the guy who sewed me up did a terrible job. Thank you, at the very least, that you used your skill to do a good job suturing the boy's knee up. You did a good job with that, so I'm grateful. Until next time, friends, shalom.